Assalamu alaikum. My name is Mukhtar, roll number BP1650167. The topic that is assigned to me is ethinyl estradiol. Ethinyl estradiol is the synthetic form of estrogen. This means that it is not the naturally available form of estrogen. Instead, it is the synthetic version of estrogen. It should be remembered that ethinyl estradiol is the most commonly used form of estrogen. Now, the indication. Ethinyl estradiol is combined with other drugs for use. It means that it is not used alone, instead in combination as a contraceptive for premenstrual dysphoric disorders, for moderate acne, for moderate to severe vasomotor symptoms of menopause, and for the prevention of postmenopausal osteoporosis. It should be remembered that with the use of ethinyl estradiol, there is increased risk of thromboembolic disorders, breast cancer, hyperpigmentation, migraine, endometrial cancer, and myocardial infarction. Its adverse effects include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles and feet. This is due to fluid retention. Weight changes may also occur. Now, the ethinyl estradiol rational use. As you know that it is used as a contraceptive, so there are three ways it produces its effect. It either prevents the release of the egg, that is, it prevents ovulation during your menstrual cycle, or it makes your vaginal fluid thicker to help prevent sperm from reaching the egg, that is, it inhibits fertilization. Lastly, it causes changes in the uterus, or it prevents the changes in the uterus to prevent the attachment of the fertilized egg. The woman should be prescribed a combined oral contraceptive with 35 microgram of ethinyl estradiol or even less. Its irrational use involved the use of ethinyl estradiol by the nursing woman. As a result, this medication passes into the breast milk, and this may have undesirable effect not only on the woman but also on the nursing infant. Its irrational use also involves its use in pregnancy. Overdosage of ethinyl estradiol may cause bleeding in females and may also lead to nausea. Now, the mechanism of action. Before understanding the mechanism of action, let us understand the receptor to which the estrogen bind. There are two main types of estrogen receptors, estrogen receptor alpha and beta. When the estrogen enters into the cell, it binds to either of these two receptors, and it promotes the production of sex hormone binding protein. This means that ethinyl estradiol does not travel in the body on its own. Instead, it requires sex hormone binding protein to be transported through the blood or plasma to the rest of the body where it is required. Its main mechanism, as I discussed previously, that when it is used as a contraceptive, it either suppresses the ovulation or it thickens the cervical mucus to prevent the travel of sperm, or it prevents the changes in the endometrium that is required for the implantation of the fertilized egg. As you know that ovulation is brought about by the luteinizing hormone, so ethinyl estradiol decreases the luteinizing hormone, thereby decreasing ovulation, or it decreases the vascularity of the endometrium, which is required for the implantation of the fertilized egg. It also increases the sex hormone binding globulin. Now, the dose. Women should be prescribed combined oral contraceptive with 35 microgram of ethinyl estradiol or even less. Combined oral contraceptive containing 50 micrograms of ethinyl estradiol should not be used for contraception. Instead, it is used for the acute treatment of uterine bleeding. When ethinyl estradiol is used in hormonal replacement therapy, its dose is 0.625 mg per day, not in a regular manner, but in a cyclic manner. That is, we start from day 1 till day 25, and on the day 10 to day 14, progesterone in the form of medroxyprogesterone is given in a dose of 2.5 mg daily. When it is used in postmenopausal symptoms, its dose is 10 to 15 microgram orally once a day. In case of prostate cancer, its dose is 0.15 to 1.5 mg orally once a day. In case of primary ovarian failure, its dose is 10 to 15 microgram orally once a day. And in case of menstrual disorder, its dose is 20 to 50 microgram orally once a day, starting from day 5 to day 25 of each cycle. Now the drug interaction. From this chart, I'll discuss the most common one, that is acarbose. The therapeutic efficacy of acarbose can be decreased when it is given with the ethinyl estradiol. Similarly, in case of acetaminophen, the serum concentration of acetaminophen is decreased when it is given along or in combination with ethinyl estradiol. Similarly, in case of epcizimab, ethinyl estradiol can decrease the anticoagulant activity of epcizimab. Therefore, ethinyl estradiol should not be given with these drugs because it decreases either the concentration or either decreases its potency. Common brand name is Osteodose, which is the product of Galaxy Pharma Limited. The drug molecule is estradiol, dose is 60 mg. It is available in the form of gel. You can see the picture. Toxicity. When ethinyl estradiol is given in high doses, it can lead to withdrawal bleeding, nausea, vomiting, breast tenderness, abdominal pain, drowsiness, or even fatigue. While managing the toxicity of ethinyl estradiol, we also need to monitor the potassium and sodium concentration and also the signs of metabolic acidosis. Now, the alternatives. Estradiol 17 beta is the natural estrogen which can be given in place of ethinyl estradiol and can be used in combined oral contraceptive. Now, the precautions. There are a lot of precautions that you need to follow. If you need to tell your doctor if you have a medical history of any of these, like migraine, headache, blood clot, stroke, eye diseases, high blood pressure, diabetes, obesity, asthma, high cholesterol levels, seizures, even heart problems, kidney, liver problems, cancer. You need to tell your patient, you need to tell your doctor about all this if you have a history of any of these. This drug can cause, as I've discussed in the previous slide, that this drug causes hyperpigmentation. This darkening of skin is usually observed on the face. Remember that sunlight may intensify this darkness and you need to avoid the prolonged sun exposure and sun lamps. Also, you need to consult your doctor regarding the use of sunscreen and protective clothing. Now the precautions. The precautions also include that if you become pregnant or you think you may be pregnant, you need to inform your doctor immediately. Secondly, avoid pregnancy for at least 1 month after stopping this medication. By this time, you can use non-hormonal birth control. Also, you need to tell your doctor immediately if you've missed your menstrual period, since this medication must not be used if you're pregnant. This medication passes into the breast milk and may have undesirable effect on the nursing infant. So you need to consult your doctor before breastfeeding. Now the contraindication. This medication must not be used during pregnancy. It is contraindicated in patients of breast cancer. Also, estrogen or ethinyl estradiol is contraindicated in patients with genital bleeding and thromboembolic disorders. Now the case study. A 30-year-old woman with no history of breast cancer, stroke, and angioedema visits her gynecologist for birth control advice. Her blood pressure was found to be 120 by 82 millimeter Hg, and her weight was 56 kgs. What advice would you think her gynecologist would give her? This is her biochemistry result. All these levels you can see are in the normal ranges. So let's proceed towards the case study. Subjective age, she is a 30-year-old woman. She is a woman. She is visiting her gynecologist for birth control advice. She has no family history of breast cancer, stroke, or angioedema. Currently, she is taking no medication. Now the objectives. The vital signs include blood pressure, 120 by 82 mmHg, which is normal. Lab report. Sodium level is 143 millimole per liter and it is not lying in the normal range. Potassium level is 3.2 millimole per liter. It is also in the normal range. You can see it from the normal range. Urea level is 7.2 millimole per liter. It is also in the normal range. Hemoglobin level is 10.4. It is slightly below the range. So you can say that she's slightly anemic. White blood cell count is also normal. Now the assessment. As she is a completely healthy woman, so the birth control pills can be prescribed to her. Her gynecologist would give her oral contraceptive as this product, uh, as she herself wants something oral contraceptive. A gynecologist would give her a medication that consists of these two hormones, levonorgestrel, which is the progesterone, and ethinyl estradiol, which is the form of estrogen. She need to take one tablet once in a day. How to start taking this tablet? There is a starter schedule. Dose should begin on the first Sunday after the onset of menstruation. If the menstrual period start on the Sunday, then she need to take the first tablet that very day. Secondly, the dose starts on the first day of the menstrual cycle, taking one tablet once a day. Okay, this is very important information. In case if she missed any dose, she need to take the dose as soon as possible. She need to continue the remaining doses at usual time, even that mean 2 doses once a day. This is the instruction that gynecologists need to give to her patient. To achieve maximum contraceptive effectiveness, the oral contraceptive pill must be taken exactly as directed at the interval not exceeding 24 hours. Women should be instructed to use an additional method of protection until after the first 7 days of administration in the initial cycle. If spotting or breakthrough bleeding could occur, the patient should continue the medication according to the schedule. If spotting and breakthrough bleeding persist, then the patient should notify her physician. If the patient misses one pill, she should be instructed to take it as soon as she remembers and then take the next pill at the regular time. The patient should be advised that missing a pill can cause spotting or live bleeding and that she may be a little sick to her stomach on the days she takes the missed pill with her regular scheduled pill if the patient has missed more than one pill. This means that taking more than one pill at a time can cause stomach disturbance, so she should take one pill once a day. These are the reference from where I've taken all this content. Thank you.